Good morning, everyone. Today we'll see about the features of the bony pelvis along with the differentiation between the male and the female pelvis. So let us have a look about introduction about the bony pelvis. So the pelvis, the meaning for this is like a basin. The pelvic girdle is formed by a bony ring which includes the two hip bones, one sacrum and one coccyx posteriorly. So they are bounded to each other by ligaments. So you can see the picture of the pelvis, it looks like a basin. So the functions of the pelvis. So what are the main functions of this? So this pelvis contains the pelvic organs including the urinary bladder and rectum in both males and females. But in females, uterus is also present inside them. So this bony pelvis protects this pelvic viscera. So that is the main function. First, protects the internal organs, especially the pelvic organs. And the second main function is the pelvis supports the weight transmission to the lower limb through the sacrum, sacroiliac joint, innominate bones and femur in standing position, but ischial tuberosity is in the sitting position. So during walking, the pelvis swings from side to side by the rotatory movements at the lumbosacral articulation. It also provides muscular attachments, and the one main function in the female is it provides bony support for the birth canal. So these are the main functions of the pelvis. So next we'll see about the joints of the pelvis. Just what are the joints that articulate to form the pelvis? So within the pelvis, two sacroiliac joints on either side and pubic symphysis anteriorly, sacrococcygeal joint, which is a joint between the sacrum and coccyx. So this comes under within the pelvis, but the joint that is associated with the pelvis is the hip joint. So the next is divisions of pelvis. So the divisions of pelvis includes the greater pelvis and the lesser pelvis. So this is according to the diameter, it is also termed as greater and lesser pelvis. According to the functions, it is also named in another names. So the greater pelvis is also termed as false pelvis, and the lesser pelvis is also known as true pelvis. So the true pelvis is for the obstetric function, so it is also termed as obstetric pelvis. So the two major divisions of pelvis is greater pelvis and lesser pelvis. Greater pelvis is also known as false pelvis, and the lesser pelvis is also known as true pelvis or obstetric pelvis because of obstetric reason. So first we'll say about the greater pelvis, and then I'll have a look about the divisions of the lesser pelvis. So the false pelvis or the greater pelvis is intercrustal diameter. So the widest point on the lateral aspect of the iliac crest. Interspinous diameter is the distance between the lateral tip of the anterior superior iliac spines. So that is the diameter between the interspinous diameter. So for the true pelvis, the diameter is very less when compared to the greater pelvis. That's why it is termed as greater pelvis. So the greater pelvis is formed by the expanded part of the ilium as well as the cavity, its cavity in the part of the abdomen. You can see in the picture the diameter between the iliac crest. Next is the false pelvis, is that portion just above the pelvic brim. It does not take part in the mechanism of delivery. That's why it is termed as false pelvis. Now we'll see about the divisions of lesser pelvis. So the lesser pelvis is divided into pelvic inlet, pelvic outlet, and the area between the inlet and outlet is the pelvic cavity. So the regions of true pelvis. So the true pelvis presents the pelvic inlet, outlet, and the pelvic cavity. We'll see one by one the boundaries. Boundaries of the pelvic inlet. Posteriorly, So the boundaries of pelvic inlet, posteriorly it is formed by the sacral promontory and the anterior margins of the ala of sacrum. So the sacral promontory is nothing but the anterior margin of the upper border of first sacral vertebra. So it is slightly inclined, and that prominent is termed as sacral promontory, and laterally there is a wing-like structure called the ala of sacrum. So together with the sacral promontory and the anterior margin of this ala of sacrum, it forms the posterior boundary, and laterally arcuate lines in the hip bone and the pectineal line together forms the lateral boundary. Now anteriorly, the upper margin of pubic symphysis and the pubic crest. So these are the boundaries of the pelvic inlet. So the sacral promontory and the anterior margin of ala of sacrum forms the posterior boundary. Arcuate lines and the pectineal lines forms the lateral boundary, and upper margin of pubic symphysis and pubic crest forms the anterior boundary. Together it forms an inlet called pelvic inlet. So now we'll see about the boundaries of pelvic outlet, that is inferior portion. Now anteriorly, just below the pubic symphysis forms the pelvic outlet, so the lower margin of the pubic symphysis. And anterolaterally conjoined ischiopubic ramus on either side. So the ramus of pubis and ischium on either side forms the anterolateral boundary. Lateral boundary is the ischial tuberosity on either side. Posterolaterally sacrotuberous ligament on either side. Posteriorly tip of the coccyx. So all these together forms the posterior boundary. Boundaries of the Now the boundaries of the pelvic cavity. Anteriorly, pelvic surface of the body of pubis, the ramus of pubis, and the pubic symphysis. All these the pelvic surface forms the anterior boundary. Posteriorly, the pelvic surface of the sacrum and coccyx. Now laterally, the pelvic surface of ilium, ischium, just below the arcuate line. So these forms the boundaries of the pelvic cavity. So let us have a look about the diameter of the pelvic inlet cavity and the outlet. Anterior-posterior diameter is 11 to 12 and 13, oblique diameter is 12 each, and the transverse diameter is 13, 12, and outlet it is very less, 11. Now the types of female pelvis. So the female pelvis is of 4 types. One is gynecoid type, second android, third anthropoid, and the last one is platypelloid. So it's clear in the picture. So the first one is gynecoid. Usually 42% of the females have this type. So here the inlet is transversely oval, that is transverse diameter is more than the anterior-posterior diameter. So the wide pelvis with less anterior-posterior diameter. Now there is spacious inside the pelvic cavity, and this type of pelvis is suitable for easy passage of the baby during delivery. So this is gynecoid type. And the second one is android, which is almost male type, 32%. So here the inlet looks like a heart-shaped. Anterior-posterior diameter is more than the transverse diameter. Pelvic cavity is funnel-shaped, and the outlet reduced in all diameters. This may result in obstructed labor. So the third type is platypelloid. It's a flat pelvis, 2.5%. So almost flat. Inlet is anterior posteriorly very compressed. So the transverse diameter is much more greater than the anterior posterior diameter. So this pose is difficult in delivery. And the last one is anthropoid, 23.5%. Now this is compressed from side to side. Anterior-posterior diameter is much greater than the transverse diameter. And this pose is difficult in smooth delivery. So these are the types of female pelvis: gynecoid, android, anthropoid, and platypelloid. Now the applied aspects. Diameter of the pelvic inlet in females are very important due to obstetrical reasons. So the pelvic fractures are more common: stable fracture and unstable fracture. In case of stable fracture, intact pelvic ring, but in unstable fracture, disrupted pelvic ring. Complicated fracture, which is associated with visceral damage that includes the urinary bladder and urethra. And iliac site is the common site for bone grafting. So let us have a look about the difference between male and female pelvis. So the male pelvis are taller, heavier, and thicker, and the female pelvis or bones are lighter and less dense. In case of male, the iliac fossa is more concave, and the anterior superior iliac spine is inturned, but in females, the iliac fossa is shallow and anterior superior iliac spine is straightforward. Acetabular cavity is large in males, but acetabular cavity is shallow in females. Again, the obturator foramen is large and oval in shape, but in females it is small and triangular in shape. In males, the pelvic inlet is heart-shaped, but in females it is almost rounded and the diameters are longer than the males. Pelvic cavity longer and more conical. In case of females, pelvic cavity is shorter and more conical. Symphysis pubis and the body of pubis are elongated. Symphysis pubis and the body are short in females. Now the pelvic outlet is small and 1 inch lesser than the diameter of female pelvis, but in female pelvis outlet is wide and anterior posterior diameter is longest. The subpubic angle is narrow and it measures about 50 to 60 degree in males. So the subpubic angle is nothing but the anterolateral boundaries. You can measure using your fingers. So in males, the angle between the index and the middle finger, that is at the inferior margin of the ramus and the pubic symphysis. So that is the angle on either side. So this just below the pubic symphysis, it makes an angle with either side. So that is, in males it is about 50 to 60 centimeter and it's almost angle between the index and the middle finger. But in females it is about 80 to 90 degree and its angle between the index and the thumb. Now the angle and depth of greater sciatic notch are narrow, but the angle and depth of greater sciatic notch are wide in females. Ischial spine or interned in females, it is not outturned, and the curvature of the pelvic surface of sacrum is uniformly concave, but the upper part is more flat and the lower part is abruptly concave. So these are the features of male and female pelvis. So let us have a look about the joints of the pelvis in detail. So the joints of the pelvis includes the lumbosacral joints above, sacrococcygeal joint below, intercoccygeal joint which is present in young children, sacroiliac joints on either side, and pubic symphysis anteriorly in the midline. So we'll see one by one in detail. Sacroiliac joints. First, the main function of the sacroiliac joint is to transmit the whole body weight from the vertebral column to the bony pelvis. So the type of joint, synovial joint. So variety is plain variety, articular ends, the auricular surface of sacrum and ilium, as well as the auricular surfaces of sacrum is covered by the fibrocartilage. So next we'll see about the ligaments present in the sacroiliac joint. So the capsule is a fibrous sac which is attached to the margins of the auricular surfaces. Interosseous sacroiliac ligament. Interosseous is a very strong ligament that holds the joint tightly, so it's that suspend the sacrum between the two iliac bones, and it is attached to the outer surface of the sacrum to the inner surface of ilium, and it is also covered posteriorly by the dorsal sacroiliac ligament or the posterior sacroiliac ligament. And the next ligament is anterior sacroiliac ligament, which is thick and located at the anterior and inferior parts of the capsule. Posterior sacroiliac ligament, which lies over the interosseous sacroiliac ligament and stretches between the intermediate and lateral crest to intermediate and lateral sacral crest to PSIS, that is posterior superior iliac spine. And the last ligament is accessory ligaments. So the accessory ligaments consist of a flat portion and thin portion. So the flat triangular portion is the sacrotuberous ligament, and the thin triangular portion is sacrospinous ligament. Relations. What are the structures related to this joint anteriorly and posteriorly? Now coming to the posterior relation, erector spinae is located posterior to this. Gluteus maximus is located posteriorly, and the sacrotuberous ligament also lies posterior to this joint, but anteriorly in the abdominal surface, iliacus and psoas major, iliolumbar vessels, and the obturator nerve is located in the abdominal surface. In the pelvic surface, piriformis, lumbosacral trunk, and internal iliac vessels. Now the blood supply for this joint is iliolumbar artery, lateral sacral artery, and superior gluteal artery. And the nerve supply is superior gluteal nerve, first and second sacral nerves. Movements for this joint: slight antero-posterior rotatory movements occurs during flexion and extension of trunk. The applied anatomy of this joint is subluxation of this joint is due to the strain on the ligaments, and it may persist even after pregnancy. So that's all about sacroiliac joint. Coming to pubic symphysis, which is located in the midline anteriorly. So the pubic symphysis type is secondary cartilaginous joints symphysial type. Articular ends, symphysial surface of body of pubis covered with hyaline cartilage. Now the ligaments attached to this pubic symphysis joint is superior pubic ligament, inferior pubic ligament, anterior pubic ligament, and interpubic disc. So these ligaments are named according to the location of this ligament. So superior one is located superiorly, inferior ligament is located inferiorly, anterior ligament is located anteriorly, and interpubic disc is the fibrocartilaginous disc, which is located in between the pubis and the midline. So the superior pubic ligament extends between the pubic tubercles and that connects the pubic bone superiorly. But the inferior pubic ligament connects the lower borders of the symphysial surface of pubic bones. It is stronger than superior ligament. Anterior pubic ligament covers the joint anteriorly, and the disc, as I told you before, is a fibrocartilaginous disc-like structure which is located between the symphysial surface of the body of pubis, that is between the articulation. So the main functions of this joint pubic symphysis: there is a very slight movement that occurs at pubic symphysis, but during pregnancy this movement increases at the pubic symphysis. And the third joint is lumbosacral joint. So the sacrum, superior surface of the first sacral vertebra, articulates with the inferior surface of the fifth lumbar vertebra. So that forms the median lumbosacral joint. So its superficial joint includes the intervertebral disc. But lateral lumbosacral joint is the articulation between articular facets. So the inferior articular facets on either side of the fifth lumbar vertebra articulates with the superior articular processes of the first sacral vertebra. That is, at the base of the sacrum, there is a small processes projects instead of superior articular process. So this articulation forms the lateral lumbosacral joint. Now the ligaments here, iliolumbar ligament and lateral lumbosacral ligament. Iliolumbar ligament extends from the apex of the transverse process of L5 to the inner lip of iliac crest. Now lateral lumbosacral ligament extends from the lower margin of transverse process of L5 to the ala of sacrum. Now supplies L5 and S1 spinal nerves, movements, flexion, extension and lateral flexion. So the clinical anatomy is lumbosacral angle, sacralization of L5, lumbarization of S1 separated from the sacrum, and sacralization is fusion of L5 with sacrum. And spondylolisthesis is a forward slippage of the vertebral bodies. So these are the clinical anatomy of lumbosacral joint. And the next is intercoccygeal joints. So this is the joint which is present only in young children before getting fusion. So it is also a symphysial type of joint. So the fusion of this intercoccyx begins at the age of 20 years and complete by 30 years. Now the last one is sacrococcygeal joint. So the joint between sacrum and coccyx, it is a joint between the apex of the sacrum, that is the inferior and apex, with the base of the coccyx. So both these are triangular in shape, so it has a base and apex. So the apex of sacrum articulates with the base of the coccyx. That is, apex is nothing but the inferior surface of the fifth sacral vertebra, and the base of the coccyx is nothing but the superior surface of the first coccygeal vertebra. So these two articulate to form a sacrococcygeal joint, and the type is symphysial type, secondary cartilaginous joints, articular surfaces, apex of sacrum, base of the coccyx, along with a small fibrocartilaginous disc in between this. So the ligaments are anterior sacrococcygeal ligament, posterior sacrococcygeal ligament that includes the superficial and the deep layer, lateral sacrococcygeal ligament, and the last is intercorneal ligament. So the intercorneal ligament is the ligament that stretches between the cornea of sacrum and cornea of coccyx. So that holds all these ligaments holds the sacrococcygeal joint together. So anteriorly, anterior sacrococcygeal, posteriorly there is sacrococcygeal ligament. So the posterior consists of superficial and deep layer, and laterally you have lateral sacrococcygeal ligament, and the last one is intercorneal ligament. Now the nerve supply for this joint is S4 S5 spinal nerves as well as the coccygeal nerves. The movements here at the sacrococcygeal joints are slight flexion and extension during defecation and parturition. So that's all about the sacrococcygeal joints of pelvis. So today I have seen about the bony pelvis features, difference between male and female pelvis, and the joints that present in the bony pelvis. So thank you.